How over is the COVID-19 pandemic? The short answer is not by a long shot. First, the end of a pandemic, by definition, means a global end. On the African continent, only 1% of the people have been vaccinated. This is not from reluctance, but due to the unavailability of the vaccine. Even in the United States, forecast remains glim. Less than 3 months after the Centers for Disease Control and Prevention had said that vaccinated people need not mask indoors or outdoors based on the high protection conferred by the 3 COVID-19 vaccines authorized in this country, the CDC reversed course, urging people to wear masks in schools and public indoor spaces in parts of the country with high or substantial coronavirus transmission. The change in guidance comes as the highly transmissible Delta variant sweeps the nation that is still struggling to get enough shots in arms. The Delta variant and lingering vaccine hesitancy are forcing an early end to everyone's carefree COVID summer. The country, the USA, is seeing more than 40,000 new cases of coronavirus infections a day, an increase from a low of about 11,000 cases a day in June. The uptick is largely driven by the Delta variant, a far more infectious strain of the novel coronavirus. Moreover, the rate of vaccination continues to slow, with about 500,000 people a day getting shots now, according to Washington Post's vaccine tracker. And breakthrough infections also are cropping up among vaccinated sports stars and politicians who are tested regularly. The U.S. Surgeon General said Sunday that he's concerned about what lies ahead, with cases of COVID-19 increasing in every state, millions still unvaccinated, and a highly contagious virus variant spreading rapidly. Noting that nearly all coronavirus deaths now are among the tens of millions of people who haven't received shots despite widespread vaccine availability, Dr. Vivek Murthy painted an unsettling picture of what the future could hold. Overall, 47.9% of the U.S. population is fully vaccinated, while 20 states have fully vaccinated more than half of their residents. This surge has alarmed officials in Mississippi, where only a third of the population is fully vaccinated. We've seen almost an entire takeover in the Delta variant, said State Health Officer Dr. Thomas Dobbs. We're seeing a lot of outbreaks. We're seeing a lot of outbreaks in youth. We're seeing a lot of outbreaks in summer activities. We're also seeing a lot of outbreaks in nursing homes, where we have our most vulnerable people, he said. The Delta variant's rapid rise is troubling, CDC Director Dr. Rochelle Walensky said of the dangerous COVID strain in a White House press briefing Thursday. The more transmissible Delta variant is now the most dominant strain of the coronavirus in the United States, representing over 50% of the cases in the country, according to data released by the Centers for Disease Control and Prevention Wednesday. What shall we do? What shall we do in the face of these scientific and statistical facts? First, get vaccinated as soon as it's medically feasible for you to do so, and advise as many people as you influence to get vaccinations too. Vaccination is our best tool in getting this pandemic under control. Second, follow the advice of the American Medical Association, the American Hospital Association, and the American Nurses Association, and continue to mask up, regardless of your vaccination status. 3, continue to follow physical distancing guidelines. 6 feet makes a big difference. 4, continue to wash your hands often and to use hand sanitizer when hand washing is not feasible. And 5, don't allow peer pressure or apathy to deter you from taking care of yourself and others. UCOM is committed by our core values of community, faith, and respect to protecting our staff, volunteers, and neighbors by adhering as closely as we can to these 5 tenets. We will continue to do so until we have evidence that we're safe to relax some of these standards.